level, the body really views that more like an infection, and so starts making antibodies in order to fight off this, quote, infection. And then these antibodies cross-react. So if you can bring the counts back down to normal, the antibody titers drift down to normal, and then the antibodies are not just poised and waiting to react to any mold in the environment.
Interesting.
So the person still can benefit from taking, you know, precautions to reduce the mold counts in the home or, you know, in their work environment by keeping things dry with a dehumidifier,
sure,
or, you know, clean and etc. Right. But they will find they become much less sensitive.
Because I know there's some people that are more allergic to certain things than others, of course, because like you're saying, more maybe yeast in the intestinal tract or what have you. So it sounds to me like it's an individual thing.
It is.
A fight against these allergic reactions that are going on in this environment or in your own home. I mean, in other words, if your own environment isn't cleaned up, then you're going to have a problem dealing with the environmental things.
Exactly. That's exactly how it goes. You know, so you really need to just kind of work with the person and try to figure out where the imbalances lie in the person.
That's interesting.
So we talked a little bit about adrenal glands.
Yeah, let's talk about adrenal glands, because who's under stress today? Everybody's under stress today.
Yeah.
So what can we do? I mean, because we know that the stress is going to be here. We can't just walk away. I guess unless we leave and do nothing and just walk away and go to some island. Of course, then we can get away from all the stresses, right? But we can't do that. That's impossible. So we cannot do that. So what do we do as far as getting adrenal glands back into so they're functioning properly? First of all, I would like to talk a little bit about what do the adrenal glands do, Dr. McDougall? What's the whole mechanism here?
Well, the adrenal glands are endocrine producing, they're hormone producing organs, let's say. They sit on top of the kidneys.
Okay.
And when most people think about the adrenal glands, they think of adrenaline.
Right, exactly.
And they do secrete adrenaline. But there's another part of the gland that produces a variety of other hormones, the most important of which is cortisol.
Okay.
And cortisol's job, cortisol has many jobs, but it's the primary hormone that helps us respond to chronic stress. It helps keep our blood sugar steady in between meals, and it keeps our immune system in check. So if we've been under stress, chronic stress, for prolonged periods of time, oftentimes our adrenal glands fatigue a little bit, and they start underproducing cortisol. And when a person doesn't have enough of this valuable hormone cortisol, they do not respond to stress as well, and their immune system is allowed to run rampant.
Wow.
And this is when people will develop a lot of allergies to things. Because if you don't have enough cortisol to kind of keep things in check, the body starts producing antibodies to almost everything it comes in contact with.
Okay.
So you'll find that the people will develop a lot of allergies to airborne pollens, grasses, possibly chemicals even.
Okay.
They'll start producing antibodies to the foods they're eating, and sometimes, in severe cases, will make antibodies against the body's own tissues, and a person can develop autoimmune disorders.
Yes, I've heard of that.
So when you find someone who says, I'm allergic to everything, my allergies get worse every year, and now I find like I'm allergic all year long, you really need to go look at their adrenal glands and see how well they're functioning.
So what can we do then as far as, say if you find out that there is a problem, say in the adrenal glands, is there something we can do, or something natural or whatever can we take to go ahead and balance those adrenal glands so to get the person not so allergic to these particular environmental pollens or what have you?
Yes, there really are a lot of things you can do, but it depends on the pattern of adrenal weakness.
Okay.
So I like to, like always,
sure,
do some testing
and
take a look at what the levels of the different adrenal hormones are, and if their cortisol is low and their other adrenal hormones are low, they will respond to some of the common naturopathic treatments that you may have heard about, like Siberian ginseng, licorice root extract, kind of desiccated adrenal glandular therapy, vitamin C and B6, B5. But you really have to do these, pursue these therapies under the supervision of a medical doctor, or someone who's trained in natural medicine.
Absolutely.
And some people with high blood pressure have to be careful. But generally speaking, if the adrenals are universally depressed, those kind of therapies are very helpful. Occasionally, someone will have a situation where they are deficient in just one adrenal hormone, specifically cortisol.
Okay.
And in that situation, other therapies are warranted. Occasionally someone really benefits from natural hormone replacement for just short periods of time. That will often allow the adrenal glands to rest a little bit and start to regenerate, and eventually the person will just find their allergy symptoms diminishing.
Now let me ask you a question.
Rewarding.
Let me ask you a question then. If somebody comes in, say, to your particular practice, okay, and you run these tests, and you put them on, say, some natural remedies or what have you, or whatever you're going to put them on, hormones or whatever it is, okay? Now, do you go ahead and when you send that patient out, you check that patient, say, in 3-4 months and find out exactly what their blood levels are or how they're doing from that point then to determine which way you need to go from there then?
Yes, that's a very good point. And whenever I do hormonal work with anybody, I actually like to try to retest their blood even as soon as 6 weeks after starting a therapy. Because everyone metabolizes hormones differently, handles them differently. Some hormones can be converted into other hormones. So you just like to see where the levels are in about 6 weeks. And then you can go from there, whether you need to increase doses or decrease doses or discontinue.
Oh, okay. So you're monitoring that patient then as you go along. You just keep monitoring and find out exactly what they need then.
I do.
I like that. I like that because you're following that patient. You're getting out right to the root cause of that particular problem so they can go ahead and arrest this particular condition.
Right.
Now what about, let me ask you, say if somebody's been taking, say, maybe prescription medication for allergies, say for a long period of time, would it be wise, say, to work with, say, their physician and say maybe you guys kind of work together in tandem as a partnership to go ahead and relieve this patient of these allergies? Have you done that before?
Yes.
Or do you recommend doing that?
I do. I mean, that's always the best way to proceed. So you're keeping communication with the other types of practitioners that are working with the patient. But usually if you can start supporting the system, removing these underlying factors that make people prone to allergies, it is not too long before they can start weaning themselves off of the medicine under the guidance of their physician. So it's very effective.
Okay, now because you hear a lot of people say, well, my brother took bee pollen, or my uncle said take Siberian ginseng, and if you take that, that'll take care of it. But unless you're being monitored and checking for hormonal levels or blood levels of these particular situations, you're never going to be able to go ahead and exactly say just take this one remedy and this is going to do it then. I think a lot of people want to say take one thing and that's it. It doesn't work that way, does it?
Right. You get so much better results if you tailor the therapy to the patient and really get a sense of what's going on.
Exactly.
Yeah.
Let's talk about a little bit about natural antihistamines. I mean, a lot of people say, well, is there any natural antihistamines that are available for me to take because I want to take some of those? Is there any recommendations for, not recommendations, but is there such thing as natural antihistamines that work?
We spoke just a bit about quercetin, which is from the grapefruit skin, bioflavonoid, and it has been shown in research to inhibit the mast cell degranulation, which releases histamine, and stinging nettle, which is a very helpful herb with allergy symptoms.
And so a lot of people would prefer, I know a lot of people prefer to take some natural remedies. The way the health trend is going today, they all want to go into a natural, more of a natural approach. That's what I'm finding out. I know in the year 2000 here, to say, well, I've been taking these prescription drugs for years and they help a little bit and sometimes they don't. What else can I do? I want to take something that's more natural to my body. So in these particular, in that particular situation, you can say maybe you should try, say, stinging needle or what have you, and it might be just as effective, maybe more effective.
Occasionally you can, and those therapies are even more effective if you're working at those underlying factors we've been talking about: the adrenal gland health, whether removing food allergens from the diet, cleaning up the gastrointestinal tract if it's a mold allergy situation. So then those natural adjunctive therapies have more power.
I understand. Now, do you see more, say, allergic reactions or people that are more prone to allergies, say, maybe in a female versus a male, or some